the York Street campus and some of our ambulatory sites, we have the Zoll AED Plus, and that's in a green clamshell. There is a pad loaded into the device, or should be loaded into the device. We know it's ready when we have a green check in the window here. And as part of our readiness check, we look to see the dates of the next preventative maintenance and when that is, and then the expiration date of the pad that's loaded, which is placed on this yellow sticker here. If we use the AED, we call 688-9000 to have a new pad loaded. And we may have a backup pad at the bedside, which is either adult or pediatric. This is a sample backup adult pad, and you can see that it has a picture of the green AED Plus. And this is not the pad for the Zoll M-Series manual defibrillator. If you keep backup pads at the bedside, please make sure that the expiration date is current. In a cardiac arrest, our goal is to get the AED on in less than 2 minutes and analyze the rhythm. I'm turning on the AED.
Unit, okay.
I'm applying to the patient with a minimum of interruptions in CPR.
Check responsiveness. Call for help.
On my count, interrupt CPR so I can place the
Attach
pad.
insert pads to
1,
patient's blood
2,
chest.
3, stop CPR. Resume CPR.
Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button.
Shocking on 3, clear the patient. 1,
Don't
2,
touch patient.
3,
Press
shocking
flashing
now.
shock delivered.
Resume
Start
compressions.
CPR.
This is what the pads look like when they're properly positioned. If you have a patient with a larger body habitus, pull down on the pad and you can extend out to be able to fit the patient and properly connect.
Now we'd like to teach you how to transition a patient from the Zoll AED Plus to the Zoll M-Series manual defibrillator. The AED is going to tell us if the rhythm is shockable or not shockable, but when our adult medical emergency team arrives, they will want to use a manual defibrillator so that we can read the rhythm. We can stay using the AED pad and transition the patient to the Zoll M-Series. So I'm going to remove the pad from the AED. And we're going to show you how to remove the multifunction cable from the paddles and insert it this side up with your shock, opening up this clip to click into the defibrillator. If your device does not have seated paddles, you can also find that the multifunction cable may be sitting in the test plug. And you'll note this side up messages with your shock symbol. So you are looking for the cable with the shock symbol in order to connect your patient to either the pads that go with the M-Series or the Zoll AED Plus pad. So this is the Zoll M-Series biphasic manual defibrillator. This is primarily available at our York Street campus. This particular defibrillator has paddles. And going over the parts of the defibrillator, we've got a handle, our battery, paddles, our multifunction cable, which connects to the pads, is housed either in our paddles or in the test plug. In order to remove the multifunction cable from the paddles, one must pull up on the release button here and free the multifunction cable from the paddle. If your multifunction cable is in the test plug, you will see this side up message, and you're looking for that lightning bolt. In the back of the defibrillator is your power cord, and also the 3-lead ECG
No.
cable. We're going to show you how to perform defibrillation with your patient in the Zoll M series. So the first things that you would do as you're doing compressions is make sure that the Zoll M series pads are placed in a heart sandwich position, so anterior and lateral position on your patient. Acknowledging that all of our patients have different sizes and body habitus, and that we're placing those pads correctly. At the end of the pads is your connection to the Zoll M series, and we are going to connect the pads to the multifunction cable, often housed in the paddles. You'll make sure that your pads are connected. This side up, look for your lightning bolt or your shock, and this clip connects the pads to the defibrillator. When we're using the Zoll M series in a cardiac arrest situation, once we've applied the pads, we want to turn the device on, read the rhythm, and assess if we need to deliver a shock. We can turn the dial right on to defib, and we notice that on the screen the device is reading from the pads which are on the patient. If you have the pads on only, you can press lead to make sure that you are reading your rhythm through the pads without taking the time to place the 3-lead ECG. As you can see, we're in ventricular fibrillation and time is of the essence to shock, our goal being 2 minutes or less. So we're going to go ahead and arm our defibrillator and charge it to 200 joules for defibrillation shock. We've gone up on our energy select to 200 and press the charge button. The button lights up and the tone changes when the defibrillator is ready to shock. You're going to say, shocking on 3, clear the patient, 1, 2, 3, I'm shocking. Press the shock button, and we're going to resume compressions. Now we're going to go over the use of the Zoll M series in a cardioversion situation. Our patient here is in an unstable atrial fibrillation, and with our team at the bedside, we've done a timeout, and we've assessed that our patient is unstable and we want to deliver a cardioversion shock. For atrial fibrillation, often our energies are higher, and we are going to provide cardioversion at 120 joules. We notice that our Zoll M series is turned to defibrillation, and our energy is set on the screen to 120 joules. It's very important, although our patient is unstable, they still have a pulse, and we want to make sure that we are using a synchronized shock, and we're going to go ahead and press the button on the bottom screen in order to ensure that our cardioversion is successful. As we've pressed the sync button, we can see that we have a dot on top of each QRS, and the machine will be able to deliver the energy at the appropriate time in the ECG cycle. It's important to note that the two steps to ensure a safe cardioversion are to make sure that we have the sync button on, and not only do we need defibrillator pads on the patient, but we need to have the 3-lead ECG applied along with the pads to make sure we're successful. We're going to go ahead and make sure that we're going to go ahead and we are going to arm the defibrillator. So if we could charge the device. And again, the device is ready when the button lights up. And we're going to say, shocking on 3, 1, 2, 3, and we're going to press and hold our button. And the energy is going to deliver at the appropriate part in the cycle. And we will be assessing our patient. You note that the defibrillator is going to default back to defib and unsynchronized for safety. It's important to make sure every single time you're doing a cardioversion, you are pressing the sync button. Now we're going to use the the Zoll M series defibrillator to provide transcutaneous pacing. And for our patient in an unstable 3rd-degree heart block, we've applied the pads to the patient's chest, and we've also applied the 3-lead ECG. We are going to go ahead and make sure that we're going to turn our knob to the pacing function. And we see the green pacer and the 2 green dials. Our defibrillator is set to a default of 70. We're going to go ahead and our physician is ordering a rate of 80. So we're going to turn up the rate to 80. And we are going to dial up our MA until we achieve capture. And we know that we've achieved electrical capture when we see a pacer spike prior to each QRS, and we're demonstrating that here. For this particular patient, we're at an MA of 80 and a rate of 80. In order to make sure that our patient is accepting our transcutaneous pacing, we're also going to go ahead and ensure mechanical capture. We're going to check a femoral pulse, and we're going to check a blood pressure, assess our patient's mental status. We understand that checking a peripheral pulse is not acceptable during transcutaneous pacing. Our patient will demonstrate fasciculations, and that can be misinterpreted as a radial pulse. So make sure you are checking a central pulse, a blood pressure, and your patient's mental status.